Amlodipine, one of the most commonly prescribed medications for high blood pressure and chest pain. Over 100 million people take it globally, and for many seniors, it's become part of their daily routine, just like brushing their teeth. Doctors hand it out like candy, calling it safe and well-tolerated. But the truth? That little pill might be doing a lot more harm than you think, especially if you've been taking it for years. Most people chalk up strange symptoms to aging or stress, not realizing that their medicine cabinet could be the root of it all. Let's start with one of the most overlooked and most terrifying side effects: brain fog. If you've been feeling fuzzy lately, like you're constantly distracted, forgetting simple things, or feeling mentally slow, this drug might be to blame. Amlodipine doesn't just work on the heart. It crosses into the brain and starts interfering with calcium channels there too. Those channels are vital for mental clarity, memory, and alertness. When they're disrupted, it's like someone dims the lights in your head. You might wake up feeling fine, but then suddenly forget why you walked into a room. You'll be in the middle of a conversation and lose track of what you were saying. These aren't isolated moments. For some, they're daily battles. It's subtle at first: a misplaced wallet, a forgotten appointment. But over time, it can feel like your mind is slipping away. And here's the worst part: it's usually not recognized as a side effect. Many seniors get misdiagnosed with early dementia or are told it's just normal aging. No one bothers to check if the culprit is right there in your daily pill organizer. According to data listed on drugs.com, over 19% of patients taking amlodipine reported dizziness and slowed thinking. But even that stat is considered low priority in most clinical visits. It doesn't help that these symptoms don't show up overnight. They sneak in over weeks and months, quietly lowering your quality of life. Your friends might notice before you do. You might stop reading books, struggle to follow a TV show, or get frustrated trying to do basic tasks you once enjoyed. And still, most doctors don't bring it up, because technically the drug is doing what it's supposed to, lowering your blood pressure. But what good is stable blood pressure if it comes at the cost of your mental sharpness? Seniors are already more vulnerable to cognitive decline, and taking a drug that actively accelerates that process is, frankly, dangerous, especially when there are alternative medications that don't cross the blood-brain barrier as easily or disrupt mental function. Now moving to the next side effect, you probably won't believe me when I say this. The drug that's supposed to protect your heart can actually mess up your heartbeat. Yep. Amlodipine, the go-to medication for high blood pressure and angina, has been directly linked to irregular heartbeat, palpitations, and even tachycardia, a dangerously fast heart rate. Let's be specific. The American Journal of Cardiology reported that 10 to 12% of patients on amlodipine experience some form of racing or irregular heartbeat, especially during the first few months of starting the drug. And yet, almost no one is warned about it. Most patients are told to expect some dizziness or fatigue, but when your heart starts fluttering in your chest like a trapped bird, no one's connecting that back to the blood pressure meds. Take Richard Callahan, 64, from Oregon. 2 weeks after starting amlodipine, he woke up one night drenched in sweat, chest pounding like he'd just run a marathon. He ended up in the ER, where the EKG showed sinus tachycardia, over 120 beats per minute at rest. His blood pressure was stable, but the rhythm was off. The ER doctor gave him fluids, did some basic checks, and told him to follow up with cardiology. His primary doctor's response? Let's increase your dose. That's not an isolated story. There are hundreds of cases logged with the FDA's Adverse Event Reporting System, FAERS, describing the same pattern. Patient starts amlodipine, heartbeat becomes irregular, and instead of reevaluating the drug, the dosage is raised. Meanwhile, patients are left thinking they're developing new heart conditions, when in fact, the condition is being triggered by the treatment itself. Even worse, if the patient already has an existing condition like atrial fibrillation, amlodipine can throw them completely off rhythm. And without continuous monitoring, which, let's be honest, most seniors don't get, the symptoms just build until something goes very wrong. Now, while the heartbeat side effect can feel terrifying, the next one is something doctors often treat like it's no big deal. But trust me, it is. Let's talk about swollen legs and ankles, also known as peripheral edema. And it's way more than just a little puffiness. This side effect affects up to 30% of users, according to a study published in JAMA in 2001. That's nearly 1 in 3 people on amlodipine developing swelling in the legs, feet, or ankles, sometimes to the point where they can't wear their shoes. What's happening here is simple. Amlodipine widens your blood vessels, but in some people, especially the elderly, it causes fluid to leak from those vessels into the surrounding tissues. That trapped fluid has nowhere to go, so it just builds up, and gravity pulls it straight to your legs. What most people don't know is that chronic swelling like this is not cosmetic. It's a red flag. It signals that your vascular system is under stress, and over time it can lead to walking difficulties, chronic inflammation, and even venous ulcers, especially in diabetic or immobile patients. In fact, a 2015 clinical review from Cleveland Clinic Journal of Medicine pointed out that physicians frequently fail to address or even document moderate edema in seniors on calcium channel blockers like amlodipine. They just accept it as a normal trade-off for controlled blood pressure. But think about what that means. A third of patients are walking around with ballooned ankles, compressed veins, and the increased risk of infection or immobility, and no one's doing anything about it. Some are even prescribed more drugs to manage the side effect of the original drug, which, let's be real, makes the whole situation feel like a never-ending loop. And if the swelling happens in only one leg, that's an even bigger concern, because it could be a sign of deep vein thrombosis, DVT, which can lead to life-threatening blood clots. But once again, since edema is such a known side effect of amlodipine, doctors often skip the deeper investigations. They just assume the pill is working and the swelling is manageable. Next is a bit serious, and rest assured, I'm not telling you all this to make you afraid. This isn't about fear, it's about awareness. So don't panic, but don't ignore it either, because the next 2 side effects of amlodipine are the ones most overlooked. Let's start with liver damage, the kind you don't see until it's already doing its work. Amlodipine is metabolized through the liver's cytochrome P450 system, and both the FDA's official drug label and the LiverTox clinical database confirm that the medication has been associated with elevated liver enzymes and, in rare but real cases, drug-induced hepatitis. Now here's the catch. This damage doesn't come with warning bells. There's no sudden pain, no loud symptoms. It often starts with unexplained fatigue, sluggishness, or even just a yellowish tint to the skin and eyes, classic jaundice. But by the time those signs show up, the damage might already be well underway. In 2013, a clinical case reported in the Annals of Hepatology described a 76-year-old patient who was prescribed 10 milligrams of amlodipine daily for hypertension. Within 2 months, he began experiencing persistent fatigue, mild upper abdominal discomfort, and dark urine. Lab results showed ALT and AST levels more than 3 times the normal limit. After ruling out viral causes, imaging, and autoimmune panels, he was diagnosed with amlodipine-induced hepatotoxicity, a diagnosis that only came after liver biopsy confirmed inflammation and cellular degeneration linked to drug metabolism. That case wasn't a one-off. The LiverTox database, maintained by the National Institutes of Health, has multiple documented entries of patients developing cholestatic or hepatocellular liver injury within weeks to months of starting amlodipine, especially when combined with other liver-metabolized drugs like statins, NSAIDs, or anti-diabetics. And yet, most seniors, especially those over 65, rarely undergo regular liver function tests, LFTs, unless a specific liver condition is already suspected. Blood pressure meds are viewed as routine. So the creeping liver damage? It gets blamed on getting older, slowing down, or even retirement stress. But it's not just about isolated liver issues. The bigger problem comes when amlodipine is combined with multiple other medications, something that's extremely common among older adults. According to a 2022 report by the Journal of the American Geriatric Society, the average American over 65 takes at least 5 prescription drugs daily. Each one adds pressure to the liver. Amlodipine isn't alone in causing trouble, but it can be the tipping point that sends liver enzymes into dangerous territory. And the worst part? You might never know until something goes very wrong. Unless your doctor runs routine liver panels, ALT, AST, bilirubin, ALP, and tracks changes over time, you could be living with silent liver stress while thinking everything's under control. Now let's talk about something even more hidden, but just as real: a side effect that hits patients where they least expect it, and where most are too ashamed to speak up: erectile dysfunction. The truth is, calcium channel blockers like amlodipine don't just relax blood vessels around the heart. They also disrupt blood flow to the genitals. And when blood doesn't reach that part of the body efficiently, the result is obvious. But no one talks about it. In a 2003 study published in European Urology, researchers observed that 21% of men taking calcium channel blockers reported loss of erectile function or diminished sexual desire. That's over 1 in 5. And that's just those who reported it. The real number? Likely higher. But here's where it gets complicated. Doctors rarely mention this when prescribing the drug, especially to men over 50. Why? Because they assume older patients are already facing natural declines in libido or function. So when ED shows up, the doctor nods and chalks it up to normal aging, completely ignoring the possibility that amlodipine might be the culprit. It becomes a silent side effect, one that patients keep to themselves. Because let's face it, many older men are too embarrassed to bring it up. Instead, they blame themselves. Their partners don't understand. Marriages suffer. Mental health declines, all because of a preventable problem that could have been solved with a medication change. Doctors focus on blood pressure numbers. They see 130/80 on the chart and say, perfect. Meanwhile, their patient is silently dealing with a shattered sense of masculinity, mounting relationship strain, and deep embarrassment they don't even know how to explain. Now, it doesn't stop here. There are many more side effects of amlodipine that we haven't covered, not because they're unimportant, but because we didn't want to make this video too long. But if you want a part 2 where we dive into the rest, including what your doctor should be telling you, drop a comment below and let us know. We're reading every single one.